On Friday morning, Ontario reported their latest coronavirus cases, and it appeared to be a record-setting 723. Wowzers! And right away, many people cropped up online, from anonymous accounts to doctors saying, "What's going on? This is spiraling out of control. Shut her all down." Hold on a second though, the numbers were not true. Well, not really. 75 of those numbers, give or take, were actually previous numbers from the spring and summer that Toronto Public Health hadn't yet updated to their tally. So take those numbers off and you are not actually at a record high in Ontario. Okay, well, that didn't stop some people from reporting that as a headline, that it was a new record. It didn't stop people freaking out about it. And here's the interesting part. It didn't stop Ontario Premier Doug Ford, who probably knew the truth, from announcing new restrictions in Ontario. Some real head-scratcher ones as well. Like, for instance, that gyms can now only have 10 people inside a fitness class. So not working around on the weights or on the treadmills, but in a yoga class, a boxercise, or whatever goes on in those fitness classes. Now, this rule applies strictly to all gym facilities. So whether you're a small little one or whether you've got a large cavernous space, only 10 people. One size fits all. They also announced restrictions for banquet halls, gatherings like that, and how many people can sit at each specific table. Another odd one-size-fits-all one. This all coming after it has been established and agreed upon that they don't actually know what's driving many of the cases in Ontario, and they can't isolate the variables when it comes to gyms and it comes to restaurants. David Williams is the Chief Medical Officer for Ontario, and he actually said just the day previously that these restaurant cases they're talking about, yes, they've isolated a few cases from diners inside the restaurant, but a lot of these restaurant cases are actually the staff, after everyone's gone home, going and hanging out in the back room, sharing meals together, taking their masks off, saying, "Oh, thank God that public that could infect us is gone. We can now let our guard down," but they're hanging around with each other in close quarters without masks for over 15 minutes. So they're spreading it to each other. Things that you wouldn't really know based on the headlines and based on the way our officials announce new restrictions. Seems like Ontario Premier Doug Ford has become something of a lockdown-loving leader, as a lot of people ask, are these new rules that are coming into place actually reflective of reality? I've spoken to a number of very prominent doctors, medical experts, public health officials about the various issues that are going on right now, and they want to take a much more holistic perspective to coronavirus. That it looks like this is going to be here for the long haul, that even if a vaccine comes sooner or later, it may be more like a seasonal vaccine, like influenza, and we just got to learn to live with this. And that includes being able to just go about and live our daily lives. So I don't fault officials for changing policies as their understanding of how coronavirus works changes. We can't expect them to all get it perfect right away from the beginning, but we've also got to calm down a little bit, and seeing various numbers and indicators flux one day or the other, and then suddenly announcing all these restrictions to make it look like we're doing something to appease, well, to appease what? If the folks are frustrated, they see numbers, they just get emotional about it, and they don't have the context, well, then I think it's the job of leadership to provide them with the context, to make sure that we can all go about and responsibly live our lives in a healthy fashion.